Well, first of all, my name is Victoria Sardi Brown, and it is an honor to be able to present right after Gavin. Gavin is a dear friend of my husband, Peter. Peter's in the front row with me. And Gavin and Wendy are dear friends of ours, and he is a tough act to follow, but he does leave you inspired, because I guess as a parent, I want to throw what I want to say out, because I think what he's saying is sort of right on target, because as parents, we all want to say, let's just find solutions. We're tired of hearing there's no money. We don't have funds for this. We don't have funds like that. The challenge is, let's find it. Let's find solutions, but that's not what I'm here to talk to you about. I do want to thank the IOM and the American Cancer Society for sponsoring this wonderful conference, and for Rebecca for inviting me here today. It's truly an honor, and it's an honor to be here with so many distinguished professionals, and of course, my fellow cancer advocates. I am a co-founder and the president of the Maddie Miracle Cancer Foundation. And my husband and I created this foundation in 2009 in the memory of our 7-year-old son, Maddie, who died from osteosarcoma. And Maddie, battled this disease for 14 months, but for 9 months, he had high-dose chemotherapies. He had 3 limb salvaging surgeries. He had a sternotomy, he had radiation, he had experimental immunotherapies. He had all sorts of things bombarding his body. In that time, Maddie was transformed from an active and happy child to one who was unable to walk and function independently. And my joke was always, he came in walking and he was happy, and then after his first surgery, Maddie never walked again. Maddie really couldn't function at all, and it was very hard for a 7-year-old to be transformed in that way. As a society, we think of childhood cancer as a physical disease, but it's really much more than that. Childhood cancer is much more than just about the medicine, and I learned this firsthand when Maddie was diagnosed after treatment with clinical depression, anxiety, and medical post-traumatic stress disorder. Diagnoses which all required him to have psychotropic medications. As Maddie's parent, I learned that he wasn't only fighting for his life, but in all instances, I was advocating for his mental health needs, for ways to manage excruciating physical pain, and in the process, I was confronted with a healthcare system that wondered, is it possible for Maddie to be in that much pain? So much pain that he didn't want to eat and he didn't want to drink fluids. Instead, I was encouraged to think that Maddie's pain was just that he was addicted to pain medication, or that his refusal to eat was just simply manipulation. Now, Maddie was precocious, I'll give you that, but remember, he was only 7 years old. In Maddie's 14-month battle, he never received a distress thermometer. He never received anything like a psychosocial assessment tool or any other standardized assessment tool to assess his pain or suffering. And I didn't either, as his parent who was caring for him full time. Unfortunately, we later found out that yes, indeed, Maddie could have been in that much pain, because only 6 weeks off of chemotherapy, we found out that his cancer metastasized throughout his entire body. The torment of watching Maddie die in our arms, and his death was a little different because Maddie decided he wanted to die in the hospital. That was his choice. And fortunately, that was his choice, because we could have never managed Maddie's death at home. Maddie's death was so traumatic and his pain was so enormous that he had to be put in a coma to die. So to watch our son die in our arms, unable to breathe, gasping for air, and flatlining in our arms, was the driving force for why Peter and I created the Maddie Miracle Cancer Foundation. And the foundation is to bring attention to the psychosocial needs of children with cancer and to increase access to these services. From our experiences caring for Maddie, was born our vision, which Lori and Mary Jo talked about today, to create and implement a national standard for psychosocial care for children with cancer and their families. Now, this standard would ensure that all children and families would have access to a minimum level of care from the time of diagnosis throughout treatment into survivorship or end-of-life and bereavement care. If there's nothing else that you glimmer from my words today, I hope I leave you thinking about the following. Now, you heard about these two reports today, but I'm going to emphasize them again. The IOM report in 2008, Cancer Care for the Whole Patient, and the IOM 2014 report, Dying in America, both emphasize that optimal care must include psychosocial care. Okay? I'm going to emphasize that, must include psychosocial care, and that integrating psychosocial care and palliative care are vital along the entire cancer care trajectory for positive outcomes. Yet it stuns me in the 21st century that there is a disparity in the psychosocial care and services offered in this country among hospitals. When we talk about cancer care in our communities and we lobby for this care for our children, the predominant focus is always on medical care and drug development. Yet any of us who has helped a child endure medical treatment knows that there are day-to-day issues that are just as complex and just as heartbreaking to manage, such as when your child tells you he feels ugly, that no one wants to be his friend because he's so different, or that he is in such excruciating pain and he's screaming uncontrollably, or worse, when he's telling you he knows he's dying. When we talk about cancer care in our communities and we lobby for this care for our children, we must remember that cancer care is much more than just about the medicine. It must integrate psychosocial distress and pain management needs of the patient to be effective. And this responsibility lies with all of us here in this room. Thank you for your time.